afternoon, everyone. Welcome to Health and Wellbeing Seminars. I'm Dr. Nitya Kumar, and I teach public health and epidemiology here at RCSI Bahrain. I will be speaking about the research findings that I got the opportunity to present at the 12th European Congress on Tropical Medicine and International Health, which was held in Bergen, Norway in September this year. The research was a systematic review and meta-analysis on the topic, do improved biomass cookstove interventions improve indoor air quality and blood pressure? This was part of the Smokeless Village project, which was conducted in collaboration with colleagues from RCSI Dublin and University of Nottingham. So let's get started. Poor indoor air quality disproportionately affects communities that use biomass fuel, such as dried twigs or wood, for their cooking and heating needs. They do so because they lack access and affordability to cleaner fuel options. What you can see on the slide here is a kitchen in Southeast Asia where biomass fuel is being burned using a traditional 3-stone stove for cooking. The resulting smoke from incomplete combustion of biomass fuel affects the respiratory health of not only the woman who's cooking, but also the young children that are present in the kitchen near their mothers because there are no other caregivers available. The repercussions of such exposure to household air pollution kills or results anywhere between 2 to 4 million premature deaths every year around the world. Most of these deaths occur in women and children because the responsibility of domestic labor such as cooking primarily falls on women. We see such high numbers because sizable populations in Southeast Asia, Sub-Saharan Africa, and South and Central America do not have access to cleaner fuels for cooking and heating. According to current estimates, this number will be well beyond 1 billion in the coming 2 decades. Till such time that accessibility to cleaner fuel is achieved in these communities, one interim solution is to optimize the combustion of biomass fuel, which is available to the communities, using improved biomass cookstoves, hereon abbreviated as ICS. Now, there are several types of ICS or improved cookstoves being manufactured since 1950s, and most of them have undergone multiple technology innovations. The latest one was in 2010 and 2011. And so there is no summary of recent evidence available to guide us on which of these ICS would result in most reductions in indoor air pollution. Keeping this in mind, the current systematic review aimed to assess whether ICS interventions after 2011 resulted in any reductions in concentrations of indoor air pollutants. 2 of these were assessed. One is fine particulate matter the size of 2.5 microns, abbreviated as PM2.5, and carbon monoxide. The second objective of this review was to see whether ICS interventions after 2011 resulted in any change in the blood pressure of non-pregnant adults. To gather this evidence, we conducted a literature search on a variety of scientific databases as well as gray literature. Studies were included if done after 2011, included adult participants from low middle income countries, were based on interventions involving improved cookstoves using biomass fuel, and reported the outcome measures in terms of 24 or 48-hour averages. Studies were excluded if they involved pregnant women, were based on ICS that use cleaner fuels such as LPG, solar, biogas, or others, and reported the household air pollution outcomes in less than 24-hour averages. To select the studies, we employed a 3-stage screening process using 5 reviewers in a blinded method, and data was extracted pertaining to means and standard deviations of all the outcome measures. We also extracted sample sizes for baseline and post-intervention groups. The study quality and risk of bias was assessed using Liverpool Quality Assessment Tool for quantitative studies. The effect measure used was weighted mean difference, and this was estimated using random effects model using inverse variance weights, as detailed by Dersimonian and Laird. Weighted mean difference was estimated for 4 outcome measures: PM 2.5, carbon monoxide, systolic, and diastolic blood pressure. Here's what we found. The search yielded 1,470 studies across different databases. After employing the 3-stage screening, we included 11 studies that met the inclusion criteria. Of these, 10 provided estimates for household air pollution outcomes, which were PM 2.5 and carbon monoxide. 4 studies provided estimates for blood pressure outcomes. Here's a summary of characteristics of the included studies. Briefly, there were 15 types of cookstoves on which studies were available, and all these studies had minimum 28 days of intervention period or follow-up. Most of these studies were conducted in South Asia or South Central America. Only one was from Africa. Only 2 of these studies were randomized controlled trials. The meta-analysis of mean difference between baseline and post-intervention PM 2.5 concentrations in the kitchen area showed a significant reduction in PM 2.5 amounting to 0.73 milligrams per cubic meters. Because of structural differences in most of the stoves studied, we categorized the stoves into 3 broad categories. One is standard combustion with a chimney or a venting mechanism. The second is standard combustion stoves without a chimney. And the third is advanced combustion stoves. These stoves typically use some kind of technology to optimize the combustion process, such as vaporizing the fuel. And so we repeated the meta-analysis, or we pooled the estimates within all these categories and found that the standard combustion stoves that had a chimney was the dominant driver of the overall effect seen. And they saw a reduction in PM 2.5 amounting to 0.42 milligrams per meter cube with very tight confidence intervals. We found a similar trend for carbon monoxide concentrations as well. The overall pooled effect showed a reduction in 8.3 parts per million. And with respect to subgroup analyses, standard combustion stoves that had a chimney saw maximum reductions amounting to 14.4 parts per million. All these reductions were significant statistically. With respect to systolic blood pressure, although we found a statistically significant reduction post-intervention, we did not perform subgroup analysis because of too few studies available within each category. The ICS interventions did not have any significant effect on the diastolic blood pressure of the participants. In summary, our study found that ICS intervention resulted in significant reductions in air pollutant concentrations, which are PM2.5 and carbon monoxide in the kitchen area. Seen here are the post-intervention levels in the cooking area in our study, which were 0.33 milligrams per cubic meters. There's so far only one meta-analysis that reports post-intervention values of PM2.5, which was done by Pope et al., and they report similar results, 0.38. This study was done about 5 years ago. It is interesting to note that despite significant reductions reported by this study and other meta-analyses, the post-intervention values remain 10 times higher compared to the air quality target set forth by WHO, which is 0.03 milligrams per cubic meters. For carbon monoxide, similarly, the post-intervention values that we found were 6.8 parts per million. This was, however, higher than found by other meta-analyses, which report 5.1 parts per million. The values found in our study was also higher than the WHO interim target of 6.1 parts per million. The foremost strength of this study is its utility in identifying most impactful ICS that can be recommended to communities that are unlikely to have access or affordability to clean fuel. This is also the only meta-analysis available where we can rule out the effect of pregnancy on blood pressure because pregnant women were excluded from the study. At the same time, we are also cognizant that most studies included in this work were not randomized controlled trials, and so it's not possible to conclusively rule out bias. In conclusion, we found that improved biomass cookstoves that have a venting mechanism result in most reductions in indoor cooking area air pollutants, namely PM2.5 and carbon monoxide. We recommend further research into user perspectives and acceptance of ICS with chimneys to get a more holistic insight on overall effectiveness of these cookstoves. We would like to acknowledge the funding support provided by RCSI Bahrain for publication and RCSI Bahrain Professional Development Unit for supporting with conference presentation. The findings have been published in the journal Environmental Pollution last month. Thank you.